Hello, doctor. I hope you have been enjoying the entire content that I have been sharing with you for the past 2 months. With the same energy and enthusiasm, I want to talk about some really important issues which is happening recently, and it has been surrounding medical education in India. This is a topic that has been in the news a lot recently, and I think it is crucial that we understand what's going on right now. So in this video, I would like to cover more topics. So before jumping to the topic, make sure you have to hit the subscribe button for more healthcare content and strategies, and do not forget to hit the bell icon for my future notification. So the first topic I would like to cover is a medical education in India and a complex situation. India's medical education system is at a crossroads, facing a mix of challenges that range from flaws in the admission process to serious safety concerns, especially for women in medical colleges. The recent controversies around the National Eligibility Cum Entrance Test (NEET) and the tragic case of postgraduate trainees doctor rape and murder in Kolkata have really brought these issues into the spotlight. NEET exams and controversies. So let's talk about the NEET exam, which is the main gateway to medical education in India. Unfortunately, it has been plagued by controversies like paper leaks and administrative mishandling by the national testing agencies. So everyone knows NEET was introduced in 2013 to replace multiple medical entrance exams conducted by states and universities with the aim to streamlining all the process at one roof. However, the 2024 NEET exams has faced lots and lots challenges, including discrepancies during the NEET UG exam and allegations of question paper leaks leading to arrest in states like Bihar and Gujarat. The other incident happened in Patna. People were accused of paying large sums to access the paper yearly. The another incident happened in Godhra. A teacher was caught helping students during the exam and finally claimed impossible scores. For those incidents, many people demanded a re-examination. The Supreme Court ruled on July 23 that there was no widespread issues or systemic failure, so no re-examination will take place. Moreover, many states are completely against this exam, including Tamil Nadu, West Bengal, and recently added Karnataka. Now, I would like to talk about how much money as a medical student should invest to get an MBBS seat in India. Medical education in India can be quite expensive, everyone knows, right? According to data from the Ministry of Health and Family Welfare, as of August 2023, there are 70 medical colleges in India offering 1,07,948 seats. The distribution of these seats can vary each year. Reports suggested that roughly 55,000 seats are in government colleges, while around another 50,000 are in private institutions. The difference between government and private seats highlights the challenges of accessibility. Government colleges are much more affordable, with fee ranging from 10,000 to 50,000 per year for an MBBS degree. That's why many students prefer government colleges, not only because of money. They can learn more knowledge and hands-on training and more information from government colleges. In contrast, private colleges charge anywhere between minimum 3 lakhs to maximum 25 lakhs per year, making medical education a distant dream for many people for this fee structure. So now I would like to talk about how long should a student study to become an MBBS doctor in India. For those who are wondering, the Bachelor of Medicine and the Bachelor of Surgery MBBS is an essential undergraduate medical program in India. It takes 5.5 years to complete, which includes 4.5 years of academic study followed by a mandatory 1-year internship. After completing the MBBS degree, doctors can either start practicing or choose to pursue further specializations through Doctors of Medicine like MD or Master of Surgeries like MS programs, which typically 3 years program. So there are also an option to pursue a 2-year diploma program. So now I would like to move on. How many MBBS seats are available in India? As of December 2023, there were 10,08,848 MBBS seats are available in India. However, the demand for exceed the supply with over a million applicants. The situation is even more challenging at the postgraduate level, where only 68,000 seats are available for over 2 lakhs applicants. This significant demand-supply imbalance not only drives up the cost of education but also forces many aspiring doctors to seek educations abroad in countries like Russia, Ukraine, and China. In an interview with Hindustan Times earlier this year, Mamta Phabe, who is in charge of international students acquisition at Manipal's American University of Antigua AUA College of Medicine, mentioned that around 20,000 to 25,000 Indian students go abroad each year to study medicine. So now, quota. So quota and reserved seats in MBBS education in the All India quota AIQ, up to 15% of seats in each government medical colleges are reserved and allocated through counseling by the Medical Counseling Committee. In 2021, the government announced that 27% of AIQ seats would be reserved for other backward classes like OBC students and 10% for economically weaker sections like EWS students. Seats also allocated through a state quota like NTA reserved seats for scheduled caste SC for 15%, scheduled tribes for ST 7.5%, and other backward classes like OBC 27%. Candidates in the NEET, the qualifying exam for the most medical courses in India. The NTA also reduced applications fee for candidates in these categories. Now, I would like to talk about the rising cost of medical education, an alarming trend. The cost of medical education in India is rising rapidly. According to a recent report by CNBC TV 18, quoting analyst from Anand Rathi, a Mumbai-based financial services firm, the cost of an MBBS degree could rise from the current average of rupees 5 lakh to 11 lakh by 2035. The postgraduate degrees could see similar increases despite a 110% increase in MBBS seats over the past decade. The cost of medical education has risen by 11 to 12% annually, outpacing inflation. The high cost of private medical education and the limited availability of government seats rising lots of problem. Many students who do not secure a spot in government colleges, they end up in private institutions where the fees are significantly higher. This in turn subsidizes the cost of healthcare provided at the mandatory hospital attached to these colleges. So now I want to talk about a very important message, that women's safety in medical colleges is a growing biggest concern in India. The recent rape murder case of postgraduate trainee doctor at R.J. Kerr Medical College in Kolkata has sparked outrage and concern over the safety of women in medical institutions. Several protests have broken out across hospitals in the country, demanding safety measures and speedy justice for the victim's family. This situation was further exacerbated when medical colleges in Assam released guidelines for female students and staff to follow, which includes avoiding unpopulated and dimly lit areas. Students were upset that the notice put the onus of safety on women instead of addressing the issue at hand. Then the college quickly withdrew its order after facing backlashes and some protest. Now I would like to discuss about the infrastructure of medical colleges and hospitals. See, many staff and students have taken to social media to highlight the lack of infrastructure and facilities available for doctors at medical institutions and hospitals. For example, some doctors have no proper staff room to rest in, even during 24 hours duty shifts. They end up sleeping on patients' beds or on the floor, if available, or in the lobby, cafeteria, or empty rooms. So there have been also complaints about the lack of washrooms and amenities for the staff and the doctors, with the report that these places are not properly maintained or cleaned. Additionally, doctors have recalled experiences of violence and unrest they faced from patients' families and the lack of security or trained guards available to manage such situations. Till now, we have discussed about what is going on, the medical colleges, the fees, the infrastructure, the concern, the problem, etc. etc. So now I would like to talk about what initiative has taken by the government. This Independence Day, our Prime Minister has announced to plan to add at least 75,000 medical seats over the next 5 years. This move aims to make India a global education hub, attracting international students while also alleviating some of the pressure on the current system. However, simply increasing the number of seats may not be enough. A comprehensive approach is needed, which include reforms in NEET exams, strict regulations to prevent malpractices, and a significant investments in safety and infrastructure in medical colleges. If you implement everything under one roof and if you start monitoring each and everything, definitely we can change our medical sector system. So in my conclusion, that while India's medical education system has tremendous potential, it also faces significant challenges and problems, from the controversies surrounding the NEET exams to the rising cost of education and the official issues of women's safety and inadequate infrastructure. There are a lot that to be addressed. The government initiatives like adding more medical colleges and seats are a positive step, but reforms must go beyond just increasing numbers. It's about creating a system that is fair, accessible, and safe for all aspiring doctors. As Mahatma Gandhi once said, the future depends on what you do today. It is crucial that we address these challenges now, so that the next generations of doctors can thrive in an environment that supports their growth both academically and personally. Now, I hope you found this information very helpful, and feel free to share it with your fellow doctors and healthcare professionals and NEET aspirants, and do not forget to hit the subscribe button for more healthcare ideas, strategies and information. Thanks for watching.